My dad is my best friend. Last week, he celebrated his 80th birthday. I have always been worried about his health as he has multiple chronic illnesses like diabetes, high blood pressure, and a chronic lung condition. His uncontrolled blood sugar levels make him prone to disease spells. Because of that, he is prone to falls. As my dad is a former patient at Alexandra Hospital, I called the care hub at AH hotline and spoke to Caris, a care manager. Caris consulted Dr. Desmond Teo, my dad's regular doctor at AH Integrated Care Clinic, who helped assess if admission was necessary. In the past, my dad was frequently admitted through emergency services. But this time, Clarice arranged for fast-track admission by passing emergency and admission tests. In the ward, my dad is looked after by a team comprising a doctor, nurses, care manager, and allied health professionals. Care is led by Dr. Desmond Teo. He discusses my dad's condition with other specialists and works with the rest of the care team to manage my dad's medical and rehab needs.
Morning, Mr. Tan. You are getting better, so we'll change to oral medication. Sister Pohum will remove the drip for you and will monitor your blood pressure once a day instead of 3 times a day. You'll see Norisman, our physiotherapist, who will do more exercises with you, and you can go back to your usual routine soon.
I was admitted for a fall caused by low blood sugar. I do 1 hour of exercise every day. The occupational therapist trained me to do daily activities such as hanging the laundry, helping me get back to my daily routine when I get home. Having rehab facilities next to my ward is convenient as I don't need to travel to another place.
We tailor the intensity of monitoring according to patient's care needs and progression at different stages of his recovery. This improves clinical outcomes, minimizes readmissions, and shortens the length of stay.
The use of technology eases nursing load, and routine tasks can be automated. In the past, for example, I had to toggle multiple screens to gather information to assess the patient and plan for his care. Now, the nursing app allows me to see all the interventions at one glance. With less time needed for admin work, I get to spend more time with my patients.
Usually, when a patient is discharged, the pharmacist will run the patient through the use of medication and the nurse will provide the patient with the next appointment date. Our discharge planning process includes using a list of questions to find out if the patient is confident in taking care of his own health after discharge. We also sit down with him to plan his care and set goals. During this conversation, we may uncover important information such as family dynamics, which helps us understand why our patient is not coping well with his condition.
No use lah. My legs are weak.
It's okay, Mr. Tan. Don't give up. So, Mr. Tan, what's one thing that you'll be doing once you're better?
I think I will take my grandson for a walk.
Mr. Tan, you will be discharged today, and we would like you to follow up in our integrated care clinic to see Dr. Desmond Teo. He will manage all your medical conditions, so you will only need to see one doctor.
Mr. Tan, I'm glad that you have made good progress. I'm discharging you to Queen South Polyclinic care team. After we have ascertained that our patient's condition is stable during our review at our integrated care clinic, we will discharge the patient to the primary care setting. We share the patient's care plans with his GP or polyclinic doctor and link up with the necessary resources in the community. With this new care model, we provide holistic care tailored to our patients' needs by a single care team. We work with our community partners to ensure continuous care after their discharge.
Thanks to the care team at Alexandra, my dad is recovering well. To get something to eat.
Come on, come coffee.
Okay. Brayden, I used to take you for walks.
Now I'm taking you for a walk.